I'm Bruce Trego, the Pennsylvania State Fire Commissioner. I'm at the State Fire Academy today with Administrator Tom Cook and Deputy Chief from FAME EMS, Eric Howell. We're here to discuss a little bit about the annual Firefighter Safety Stand Down, which is a joint initiative of the International Association of Fire Chiefs and the National Volunteer Fire Council. And it's coordinated by the IAFC Safety, Health, and Survival Section and the NBFC. So this is being held the third full week in June every year, and obviously we're into Thursday of the daily events. And today we thought we would spend some time at the State Fire Academy. It was rather convenient that there is a program going on here. Rehab is set up behind us, and that is one of the topics for this week. Monday was heat stress, hydration. Tuesday was cardiac health and nutrition. Wednesday was exposure mitigation. Today is mental health, and tomorrow is rehab support operations. So I think what we have to talk about here today will cover both Thursday and Friday's topics. So just as a disclaimer as we start, all the participants here are fully vaccinated, and we obviously recommend that you still maintain the social distancing and the masking where needed. Today we're outside and we are all vaccinated, so I think we're going to be good to go. And again, the brief history of what we are doing and how we got here, and why I wanted to talk to these two folks today is to talk to Administrator Cook about the rehab and the issues that we go through here at the State Fire Academy, policies and procedures there, as well as Eric can give us his input on how rehab is working for him, both here at the State Fire Academy as well as out on real incidents. So with that, I'll go to Administrator Cook and ask him to describe the rehab policy here and procedures that we are using at the State Fire Academy.
Okay, so without getting too far into the weeds, here at the State Fire Academy, when we engage in active training, we are pushing the rehab aspect, the rehabilitation of firefighters in terms of hydration, nutrition, and medical monitoring. Those are our three focus areas. So any event that we're doing that involves high levels of physical activity, we try and incorporate the rehabilitation functioning into those events. So today, what's going on behind us is our tactical fireground operations program, which involves live fire and fireground operations, with roll-ins on the rigs and everything else. So in between each fire, which right now we're in between evolutions, any crew that was in the hot zone is required to cycle through rehab and be medically evaluated, rehydrate, and if needed, get some additional nutrition on board. So, and we partner with FAME EMS here, our local EMS agency, to provide those services. This has been going on here at the Academy probably a good 2 decades now, and it's been very successful. We've actually identified some medical issues by putting people through rehab that we were able to progressively address before they became health problems, and potentially averted some line of duty deaths. So again, our focus here is on the proactive side of rehab and the prevention. How do we prevent an incident from occurring?
Okay, thanks. Just you addressed the one question I had, which was what benefit have you seen from this? And obviously I had some personal experience in the fact of they did find, it was at a local level training, but it was a rehab similar to what FAME does, where they did find AFib in me. And I know we have a couple of folks that they did find that in time. They got back to the doctor and got treated, and they are still participating. So were there any issues with participation, with the participants wanting to play?
So initially, when this was first implemented, we had the usual pushback. I'm good. I don't need to do this. And then as it was reinforced and became routine. At this point, there's very little opposition to using rehab in our training events here at the Fire Academy.
Great. Chief Howell, what policy and procedure does the FAME EMS utilize here at the State Fire Academy?
We follow the same procedures here at the State Fire Academy we would on an actual fire scene whenever we are initiating rehab. Our first and foremost is the firefighters to make sure that they are either heated, cold, hydrated, get things set up for them and allow them to do their job. We follow the NFPA standard on vital signs. It's not signs that we made up. It's pulled right out of the NFPA. If they are outside the parameters, we then will set them for 10 to 20 minutes and retake vital signs. If they come out of there, then they're released to go back into the fire, the hot zone, so to speak. If they are not and they don't come out, then the Fire Academy or the fire chief of the fire scene has the last say as to what the firefighter does. He'll either pull them out of the fire permanently until they get checked, or they'll allow them to do other things other than go into the hot zones. But for the most part, we provide hydration, we provide climate control, and a rest area. Vital signs is what we do, and we do baseline vitals as well for the Fire Academy here. Other than that, I mean, our first and foremost, our job as the firefighters to make sure that they are taken care of.
Okay, I guess I would ask you similar questions as what we asked Administrator Cook in regards to you see maybe since it's more prevalent now and more people are doing rehab, any of the folks that are kind of reluctant to go to rehab?
Yeah, here at the Fire Academy, no. I think they know here at the Fire Academy that this is an integral part of what we do here. On the volunteer end of things, yeah, there's some people that are reluctant. We sort of ease that up a little bit. We're not here to flag everybody. That's not our objective. Obviously, if you are outside them parameters, then yes, that's going to happen. But that's not our primary responsibility. We'd like to get you in, get you out, get you back into service. And a lot of people think that we are here just to flag them and then they won't be able to go do what they need to do. So we try to ease that up a little bit and make it a little bit fun for them so they do come into rehab.
Until we take care of some technical difficulties, I can move over to Tom with some other questions and concerns. I know you and I have discussed quite a bit since you came here, addressing mental and physical health with our firefighters. And rehab obviously is one of the best things that we can do on the scene. What about when they get back to the station, or if we're talking a live fire event, or even here, what's the best thing they can do after the class or after the fire?
Well, so again, the whole push nationwide, well, not just nationwide, worldwide actually, with firefighters is reduction of exposure to contaminants. So the environment, especially doing live fire training like we're doing here today, exposes firefighters to a wide range of toxins and carcinogens and poisons that, resides on their turnout gear, it resides on their station uniform, it resides on their skin. We've come light years in protecting the respiratory tract with SCBA, but we still have not really truly proactively come up with a great solution for the skin-based contamination absorption, right? So, clean yourself as quickly as you can, get a shower, clean your gear, clean your station uniform, at least change into a clean station uniform after a fire. Those kind of things. On scene, wash your hands as quickly as possible. A lot of fire departments have adopted a kind of a gross decontamination process at the fire scene where once they're finished with the fire, they actually put people through a gross decontamination routine where they hose them off, they scrub them with scrub brushes before they get out of their turnout gear to reduce that contaminant exposure. So those are the kind of things we're looking at here, obviously in our environment, every time, if they're going to be rotating through the burn building 10 times during the course of a training class, I can't decontaminate them every time. But what can we do at the end of the class to help cut down on that exposure time? During the pandemic of the last year, our facility was shut down. We were still running classes here on the training ground, but so now we've reopened the shower so the students can shower at the end of each day before they get in their car to go home from training. Those are the kind of proactive steps that we're taking here. And the same thing would apply to the fire company environment in the field, right? Can we gross decon them at the scene? Do we have shower facilities at the firehouse? Can we get them into clean clothing as quickly as possible once we get back to the firehouse? Those kind of steps for the contaminant exposure. But on the theme for today with the mental health, it's a complicated thing, but it's also simple on the hand that we just need to watch out for each other.
Correct.
I think all of us have been exposed and have felt the stress of the work environment that we've worked in one way or another. And for instance, we were together for Father's Day. We went out and celebrated our two families together for Father's Day. And on Monday, you called me and said, "Hey, were you okay yesterday? Because you were a little off." And we were able to talk about what was going on. Simple steps like that, I think, make a big difference in helping firefighters adapt and survive to the mental stress of the environment that we work in.
I agree, and I think some of it is, we all tout the fact that we're all brothers and sisters in this business. But yet, one of the, it's typical. We can fight amongst ourselves, but don't let somebody attack us. A typical family type of a scenario. But when it comes to the stigma that comes along with saying that, and I'm sure you started about the same time I did, if we complained about something on a call that bothered us, you probably got the same thing I did. Suck it up, kid. That's part of the job.
Yeah.
So I think as we look at rehab and mental health, and I want to talk to Eric a little bit about that, and is there something that we can start to look at during rehab that might catch and be able to say, like maybe, I don't know, Eric, if you want to talk to that a little bit, is there something we might be able to catch? And obviously because of HIPAA, there's not a lot we can do with that individual, but can we talk to the chief or one of the officers and say, hey, this person isn't himself. Can you check on him? Are we to a point to start doing that?
I think we can implement that in with our daily rehab stuff that we do. I don't think we're there yet. We're still honing in on our rehab with our new people and things like that. We have a rehab class that we put people through. This might be something that we would want to incorporate into our rehab class. We don't allow you to do too much of the rehab until you have our class. So that might be something we can put into the class and help out with that. As far as scene-wise goes, I think if we didn't say something to the fire chief, we're not doing our job.
Right.
I don't know how else to put that.
Well, from the Office of the State Fire Commissioner, I need to thank FAME EMS for what they do here for us, as well as in my personal life, what I've seen you folks do out in the real world. Not that this isn't real, but out in the activities upon emergency response. And I know it's difficult. People don't always want to do it, but I think we're seeing a part of a retention tool. If we're taking care of people now, catching things early, and we're able to get them addressed, I think it's a fantastic idea. Tom, you mentioned about some of the things that we have been doing, and I know you and I have had this push for both mental health and physical health. One of the things that we did do last year, and it was during the pandemic, was we contracted to have 4 classes put on Train PA, and they were entitled Being a First Responder During a Global Pandemic, Had a Bad Call, how to better support your first responders and capturing the load. 3 of those are less than 10 minutes and 1 is a little bit longer. We are in the process now of doing another contract, so we're looking to have that up and running hopefully by next month, if not sooner. So I just want to say there's some resources out there that can help us, and if anything, make us aware of what are we looking at in our brothers and sisters that we can address and maybe catch them. You mentioned our experience, and that's a little easier because we do know each other both personally and work related. And I know I've had some contact with Eric regarding some instances that we were both involved with the stress had gotten so bad that there was possibly suicide attempts. I know it's difficult, but we need to be able to take a look at that and what can we do down the road. I don't know, Eric, if you want to chip in on that a little bit?
Well, I sort of have a saying in around the station, and that is, and I heard this from Pat Pauley, and that saying is, it's okay to not be okay.
Right.
I think people don't understand that. They think that they have to have that macho, tough guy persona. In today's world, it's okay to not be okay. But if you're not okay, tell somebody you're not okay. And if we're around somebody day in and day out, we'll know when they're not okay. And it's up to us as managers, so to speak, to intervene there and find out why they're not okay, or see if we can get them to talk to us or get them the resources that they need.
That's great, and again, my accolades to what Fame EMS is doing and what other EMS providers across the Commonwealth are doing to help during rehab, and hopefully this conversation will help us take a look at not really resetting rehab, but taking a look at rehab and is there other things that we can do besides the physical issues. Can we start helping with the mental issues as we get down the road? I'll open it up to either one of you for any other comments before we wrap up or before we open up to other questions.
Well, I'd like to add in, you were talking about the formal classes on Train PA that we had the contract with. We're going to get back to the initiative that we started pre-pandemic, and then the pandemic kind of derailed us, where on the web page or the website for the Fire Commission, one of our goals was to stand up a mental health resource page for emergency responders that, in addition to the crisis phone number, there were other resources available for people to go to learn more, to become better educated, or get help if they need the help. The same thing with the cancer prevention page, that we need to get back to those initiatives now that things are quote unquote returning to normal, and start giving people the tools they need to protect themselves.
Correct, and I think I'll chip in on that and ask Eric, are you seeing any complications, if you will, of issues from the pandemic, of people having more stress? An example is, it's already a stressful job. You go sometimes to the same person time and time again for a very similar issue, and eventually that, I've heard the term compassion fatigue. You get tired of that, and I think probably in EMS, that was probably pretty prevalent during the last year and a half.
Yeah, it was pretty prevalent, and yes, there has been some times that it got a little trying, saying things over and over and over again, and we have tried to tell our people, treat that person like you would treat your own family member, to try to help with that fatigue. Now, don't always work, and it's easy to sit behind a desk, so to speak, and give that kind of advice, but it works for the most part. We just have to remember that at the end of the day, we're here for the patient, and that the patient is what matters.
And I'll tack on to that. Since we are there for the patient or the homeowner or the person in the accident, whatever their case must be, we've all said this before, the responders that are out there are trained to the best they could get. and they want to do right according to their training and their experience, but they are facing people that are having probably the worst day of their life.
Yes.
So with that in mind, it's okay to understand we're human. We have feelings too, and it may not hit us immediately, but down the road it may. So I think that's where the family thing is so relationship oriented that we can find those things. Anything else you might want to?
I just think, at times I think we're going to have to look for some PTSD signs and symptoms here with coming out of the pandemic. We've been locked down. We've been dealing with so much over the last year and a half to 2 years with provider being shorthanded. We have providers that did get the disease, and I think we're going to have to look into that a little bit closer and keep our eyes on our people.
Yeah, and I think that's what we need to do is take positives out of what happened over the last year. We saw a lot of innovative ideas, a lot of changes in the way that we do things. And just a little bit off topic here, but I think it relates, is we're looking at training in a different venue now. Yep. And still on the same topic, if you will, what are we doing in training now, especially after the pandemic? And what did we do during the pandemic? What are the best practices that we can take from that and move forward, both in training and in the real activities? So, anything else you might want to add, sir?
Well, you opened the door with the training question there. I could talk about that all day, but we, like everyone else, last March moved very quickly into the emergency remote teaching mode, where we were delivering lecture over the internet, live. And over the course of the 19 months of the shutdown, we learned a lot of things about delivering training in that environment. And we're now looking at those and trying to capture the best practices and make them a permanent part of our training repertoire, rather than just flip the switch back to the traditional method of an instructor in front of a class, delivering lectures. So, there's going to be positive change that comes out of it, but we need to be aware, as the chief said, what was the impact on the mental, and not just mental, but the physical health of our people. Of being locked in your house for upwards of 2 years, really.
Yeah, and I'll couple that with the response side of it, is these folks didn't really get that chance to, unless they came down with an issue, they didn't have the chance. They were out working in the public and taking all the precautions that they could. And I'm sure that might have had some effects on folks when they did get home, worrying about, did I get contaminated? Is there something that I might bring home? I would imagine that, not that you didn't do it before, but I know from my experience being at your station that the ability is there, the convenience is there for them to get cleaned up and for them to change their clothes before they go home. So, the shower before the hour type of thing. I think those are all lessons that we've learned and can move forward with. I think all three of us can agree that it's our concern that when we take a look at the safety stand down, this was a week for us to sit back, if you will, take a couple moments and take a look at what it is that we're doing and what we can do to improve, and just have that reset, if you will. Give us time to think about, okay, it was a bad year and a half. We're starting to get into things again. Maybe we need to take a good hard look at what we're doing and as we're moving forward. So unless either of you have anything and anybody had any questions that you might have seen, Paul, I think what we'll do is wrap this up. I want to thank everybody for their participation. Obviously the class that's going on behind us. FAME EMS, while they are here, and Eric, for you taking time away to come here and be with us, and obviously Tom for the job that you're doing here at the State Fire Academy and for local level training and certification as we move on. So I think we can wrap it up at that. And again, thank you both for taking the time today, and thank you for what you do day in and day out.
Thanks for the opportunity.
Thanks. Thank you for having me.